Giardia lamblia is a protozoan parasite which colonizes in and reproduces in the small intestine. A parasite is an organism that feeds off of another to survive. Once someone is infected with Giardia, the parasite lives in the small intestine and is passed through the feces. Giardia forms cysts, which are very resistant and can sometimes survive for weeks or for months outside the body. Giardia reproduces by binary fission and is anaerobic. The Giardia parasite attaches to the epithelium by an adhesive disc. Giardia lamblia remains confined to the lumen of the small intestine and does not spread via the bloodstream, nor does it spread to other parts of the gastrointestinal tract. Giardia lamblia absorb their nutrients from the lumen of the small intestine. Giardia lamblia causes a diarrheal disease called giardiasis. People become infected with Giardia by swallowing Giardia cysts, which are hard shells containing Giardia. Cysts are instantly infectious once they leave the host through feces. A person gets giardiasis when he or she drinks contaminated water or eats contaminated food. An infected person might shed 1 to 10 billion cysts daily in their feces, and this might last for several months. However, swallowing as few as 10 cysts might cause someone to become ill, so the infectious dose of giardiasis is very high. Giardiasis is a global disease. Nearly 2% of adults and 6% to 8% of children in developed countries worldwide are infected by giardiasis. Nearly 33% of people in developing countries have had giardiasis. In the United States, Giardia infection is the most common intestinal parasitic disease affecting humans. Anyone may become infected with Giardia. However, those at greatest risk are travelers to countries with giardiasis is common, people in childcare settings, those who are in close contact with someone who has the disease, people who swallow contaminated drinking water or eat contaminated food, backpackers or campers who drink untreated water from lakes or rivers, people who have contact with animals who have the disease, and anyone who engages in anal sex. Giardia infection can cause a variety of intestinal symptoms, which include but are not limited to diarrhea, gas or flatulence, greasy stool, stomach or abdominal cramps, upset stomach or nausea, and dehydration. These symptoms may also lead to weight loss, and some people with Giardia infection have no symptoms at all. Symptoms of giardiasis normally begin 1 to 2 weeks after becoming infected. In otherwise healthy people, symptoms of giardiasis may last 2 to 6 weeks. Occasionally, symptoms last longer. The mechanism of disease for giardiasis is unknown. Some investigators report that the organism produces a toxin, while others are unable to confirm that toxin's existence. Obstruction of the absorptive surface of the intestine has been proposed as a possible pathogenic mechanism, as has a synergistic relationship with some of the intestinal flora. Treatment is only necessary with giardiasis when there are symptoms. When there are symptoms, there are many prescription drugs to treat giardiasis. Although the health of all people can be seriously compromised due to giardiasis, infants and pregnant women are most at risk for dehydration because of the diarrhea that comes with giardiasis. In infants, diarrhea can be fatal, so treatment is necessary.